दो बार 30 सेकेंड्स है। आप अभी गो लाइव कर रहे हो, मुझे कैसे मैसेज डाल दो गो लाइव, मैं अभी फोन रख दूं? वो मैं समझ गया, अब अभी अभी लाइव है, अभी आर वी लाइव। ओके। Hello, hello, hello. Good morning, all of you. Good morning. Am I visible to all? Am I audible to all? Can all of you hear me? Can all of you see me? Hello, hello, hello. Good morning. Yes. Okay, great. Welcome all of you. Yes, welcome all of you to our rapid revision. It is going to be tremendous benefit for all of you. And last time when we had conducted this session, lots of questions had come, and the same thing will happen. So the agenda is that the most important topics. Okay, the final weapon revision starts now. I want all of you to answer. Right, wrong does not matter. सब लोग answer करना है. Even if you make a mistake, it is okay. We are here to learn from our mistakes. Okay. All good, Sai Krishna. Okay, so is the I think the audio video should be all clear. And the most important topics. Okay, I've discussed lots of. I'm going to discuss lots of topics. So specifically PCOS, endometriosis. So सारे topics जो most important है obs gynae के लिए and frequently repeated and PYQs also are going to be discussed. And before we proceed further, FMGE, keep lot of faith, have lot of motivation, guts, efforts. अभी हमने YouTube पे एक वीडियो डाला है last 20 days strategy. Please go and see that. Feel free to get in touch with me on phone and WhatsApp on this number. And do not forget, we are on the NLC channel. Thank you, Dr. Ashish sir, for inviting me. But please also follow me on Insta. Just take 10 seconds time right now. Quickly open your phone. All those, if you are not already following me, subscribe to this my YouTube channel. Also, lots of content is coming. We have recently posted an image-based MCQ, which is crossing 10,000, and also we have done last 20 days strategy. So if you have not already following me on Insta, just quickly take 10 seconds and do that. And without fail, also start following me and subscribe to my YouTube channel also. And really happy to announce, I want all of you, so many students are joining every day. This today is a 2-hour free revision for all of you. I am coming up with 3 more sessions. As you know, OBGY is a single most important subject. 30 to 35 MCQs come, and we are going to have 3 sessions live, 2 hours each, only 299 rupees. So please download the OG Guru app. In the 3 sessions, we are going to discuss the most important IBQs, clinical MCQs, and expected MCQs. More about this later on also we'll discuss. Okay, so download Doji Guru app, and this is starting from 11th June. Okay, so total 6 hours and your tremendous boost. And with this 2 hours course, all 8 hours, almost your entire OBGY rapid revision ho jayega. Okay, so don't miss out. We will be seeing you live on 11th of June at 11 a.m. in the similar time. Okay, so now let us start. I want you with the first MCQ. Okay, first MCQ. Chalo, start. Okay, I want all of you to answer. Right, wrong does not matter. 25-year-old. So when you are going to get clinical MCQs आने वाले हैं, and a concept based MCQ. Okay, so we have got a lady, obeys, married for 4 years, acne, infertility, partner. What do you think is the treatment of choice for this condition? Based on the history, can anybody give me the diagnosis? Just a rough diagnosis. Of course, there are lots of this. And what criteria do we use? Anybody? Yes, okay, somebody saying A, Mohammed Asif. I want all of you to answer. Right, wrong, nahi farak padta hai. Okay, Tanmoy, Vedika, ready, very good. Okay, so diagnosis, anybody, diagnosis. What is the diagnosis? What is the diagnosis? What is the diagnosis? Anybody? Yes, please understand this. There are pointers. Obesity. Obesity is what? It's a sign of insulin resistance. Patient is having infertility. Irregular periods suggest an ovulation, of course. And acne, hirsutism. Yes. So PCOS. And now we know the new name PMOS. Okay, polycystic ovarian syndrome. बरसों पहले मैंने बताया था कि this is a misnomer. All my students, yes or no? Yes, Rotterdam cried, Dr. Very good. So PMOS is polyendocrine metabolic ovarian syndrome, because you know there are lots of metabolic complications also. Very good. Coming to this, what criteria we use? Sir, we use the Rotterdam criteria. Rotterdam criteria में very quickly, an ovulation, hyperandrogenism, and third is the ultrasonography criteria, multiple small follicles. So again, please understand, there are no cyst in the ovary. सर नाम में था पॉलीसिस्टिक, लेकिन कोई भी सिस्ट नहीं है. ओके, कोई भी सिस्ट नहीं है. मल्टीपल स्मॉल फॉलिकल्स. एंड कैन यू टेल मी द साइज ऑफ द फॉलिकल? Can you tell me this all small follicles, okay, on ultrasonography? And any 2 out of 3 should be present. Okay, this is again an MCQ. Again an MCQ. What are the size of the follicles? Anybody? Chalo. So one MCQ pe, one more MCQ free. What is the size of the follicles? Yes, sir. All the follicles are 2 to 9 millimeter in size. They are all small. They are small, immature follicle. Yeah, 2 to 3 millimeter, but they are mainly, yes, necklace of pearl pattern, very famous MCQ. All are immature follicle, less than 10 millimeter. And can anybody tell me one more MCQ? What should be the actual size of the follicle just before ovulation? One more MCQ. So with one MCQ, I'm discussing 3, 3, 4 new MCQs. Anybody? Normally the follicle grows. So just before ovulation, what should be the size of the follicle, which is called as the dominant follicle or Graafian follicle? Anybody? Graafian follicle size. Again, a very important MCQ. Anybody? Yes, sir. The Graafian follicle is, no, that डेटांक थोड़ा सा बढ़ाना पड़ेगा, 18 to 20 millimeter. Clap if you have learned something new on a Monday morning. I repeat, the Graafian follicle is 18 to 20 millimeter in size, and then the egg will, ovulation will happen, because follicle will rupture. Okay. So that is just besides the point. Okay, so we know the Rotterdam criteria, मैंने आपको बता दिया. And this patient is having acne, hirsutism, so she is having PCOS या PMOS, whatever you want to tell. Now one word answer, can you tell me, in PMOS? Please understand this, PCOS or PMOS. Okay, the treatment, I will tell you the ultimate goal also. The treatment will depend on what the patient wants. Okay, both cases we are going to discuss. Now, can you tell me one word answer? Why is there infertility? Why is there infertility in PCOS? PMOS में infertility क्यों होता है? Yes. Yes. Very good. Trick, CT tricks, 18 to 20. Yes. Can anybody tell me infertility क्यों होता है? Yes, sir. The infertility is because of an ovulation, and therefore, whenever the patient is planning pregnancy, we have to go for ovulation induction. And please understand this. No absence of progesterone. Yeah, annually. Okay. And whenever this question came, directly many students, clomiphene citrate, wrong, clean bold. Why wrong? Because sir, clomiphene citrate was, लिख देंगे, clomiphene citrate was के नीचे 3 बार, was the drug of choice after 2018. Very good. Now we know letrozole is giving better results, better answer, and now letrozole is the first drug of choice. Is this understood to all of you? When the patient does not respond to all this, then we go for this very powerful HMG, human menopausal, from the urine. Menopausal lady सुसु करता है, यूरिन करता है, उसमें से हार्मोन निकलता है, human menopausal gonadotropin. Okay. Is it clear to all of you? So when the patient has infertility, and of course I'll tell you what more the patient has to do also. Okay, so letrozole is the answer. Letrozole ovulation induction, and remember this first option is letrozole. Letrozole, very good. Okay, now second MCQ. Chalo, now second MCQ, and then I'll complete the whole thing. Again we have got, now tell me the answer over here. Again married for 3 years. तो student क्या सोचेगा? Yes, infertility. But what is the thing? Again, acne, hirsutism, irregular periods, testosterone elevated, okay, LH36, FSH9. So look at the ratio. The ratio of FSH to LH in this case is 1 is to 4. This is again suggestive of yes. So the diagnosis remain the same, PCOS, or now we would like to call it PMOS. Yes. Now anybody? Yes. So now please understand this. If you do drilling, you have to go to jail में डालेंगे, because drilling is almost outdated, kachra has been almost never done. Now can you tell me why not letrozole and clomiphene over here? Because patient बोल रहा है कि sir I want treatment for infertility, नहीं, I want treatment for hirsutism. Okay, so always please read, clap. Is it clear to all of you? You will read what the patient wants. You will read what the patient wants. Is this understood to all of you? So sir, when the patient is having infertility, we go for letrozole, but we can have a second kind of a patient who says, doctor, I want treatment for acne, hirsutism, and irregular periods, and protect me from future cancer. Then we go for एक ही गोली. Clap if you feel happy. उल्टा कर देंगे. क्या उल्टा कर देंगे सर? PCO ulta, reverse OCP. They are made for each other. Thoko tali. OC pills will decrease the acne, hirsutism, and make the patient better. Okay, PCO, OCP, they are made for each other. Okay, PCO, OCP. Clap. That's the way to remember. So here the answer is OC pills. Is this understood to all of you? And yes, all of you understand कि sir, PCOS में there is going to be insulin resistance also. So can we add? Yes, sir. Metformin. Metformin is insulin sensitizer. We can add it to both the categories. We can give letrozole plus metformin, OCP plus metformin, and therefore do not forget, ये भी एक PYQ है कि what is the initial management for all of them? Yes, sir. Lifestyle modification. Understood है ये अंडरस्टूड है कि ऑल पेशेंट्स, चाहे दे आर प्लानिंग विथ infertility or they have got whatever complication, they want acne, hirsutism, lifestyle modification, diet, weight loss, exercise, ये सब करना ही है, isn't it? So this goes without saying, lifestyle modification, diet, weight loss, exercise has to be done. This was also a very important PYQ. Yes or no, Thoko Tali. Okay, the very important PYQ, which was what is the initial management, or what is the main stay, or the initial line of treatment, what you tell all the patient? Diet, weight loss, exercise. Okay, lifestyle modification. So I repeat, please remember this, okay, in your exam you will choose, you will have to think what the patient has come to you with. बात समझ में आ रहा है? So if the patient has come to you with infertility, then we will go for ovulation induction. But if the patient says treatment for acne, hirsutism, irregular periods, then it is OC pills. Of course, diet, exercise, metformin is understood. That can be given to both the kinds of patients. Is it clear to all of you? Clap. Is it clear? So yes, moving on, and we know the criteria as we bata diya, we know all the other things also. Yes, chalo. Again, a short topic. A girl has brought to the OPD by the mother with the only complaint that the menarche is not yet achieved. Which of the following is a primary amenorrhea? I want all of you to answer. Yes, anybody? So now primary, I mean again A B C D A B C D. Okay, A B C D. चलो, and उसके पहले चलो, I want all of you to answer. C D B C D B C D C C D. Okay, one more MCQ before we proceed further. The commonest cause of primary amenorrhea is. So ये सब सारे short questions हैं. Okay, again a PYQ. Commonest cause of primary amenorrhea. And I don't want only the first most common. I want the second most common and third most common also. Okay. So now, please pay attention, all of you. The primary amenorrhea definition has now changed. Has now changed. First, I will very quickly tell you the old definition, and then I will tell you the new, because for you to know. So, old definition was what? Sir, old definition was 14 years and 16 years. Is it clear? Now, why two definitions? Why two criteria? Yes, because sir, we have to see thelarchy, pubarchy, menarche, breast development, axillary pubic hair, isn't it? So that is called as secondary sexual characters, SSC. क्या है short form? SSC. So sir, if I see a girl in the OPD and if at the age of 14 years there is no breast development, no axillary pubic hair, then and no menses, of course, we call it as primary amenorrhea. But if secondary sexual characters are present, that means if breast development has started, axillary pubic hair growth has started, we can wait and then we label it at 16 years. Is this clear to all of you? But this is wrong, old. Now this has changed and one year less. So 14 has become 13 and 16 has now become 15 years. Is this understood to all of you? So if there's no secondary sexual characters and absence of menses, then at the age of 13, or if secondary sexual characters are present, then at the age of 15. Is this understood to all of you? Can I get 10 thumbs up, OG, in the chat box? Okay, is it clear? So now 14-year-old wrong. तो आपको एग्जाम में खाली दो ही फिगर देखना है सर, look for 13 or look for 15. Is this clear to all of you? So sir, 14-year-old, no menses, but with breast development is there. I would like to wait. We would like to wait. Is it clear? We can wait because breast development is already there. 13-year-old, no menses, but with breast development, again we will wait. Okay. 14-year-old, this is the old. Very good. Those who had said C is the answer. Okay, sir. 13-year-old has happened. Still no menses have started without breast development. C is the answer. Thank you, all of you. Thank you, Soup. Okay. Love you all. Okay. So that is the answer. Is it clear to all of you? So this is very important. Okay, and D is the old criteria. No menses without breast development. That's the old thing. Okay, clear? Yes, all of you. Okay, so keep this in mind. Now please understand this. What is the commonest cause of primary amenorrhea? Turner syndrome. Turner syndrome, also called as gonadal dysgenesis or ovarian dysgenesis. Okay, Turner syndrome is the most common cause. Okay, now can anybody tell, again very important, can you tell me the second most common cause and third most? OG Guru students, all three we should know. Anybody? All three we should know. Yes, 45 exokaryotyping, all that we'll discuss. The second most, yes, sir, RMKH is the second most common cause of primary amenorrhea, and androgen insensitivity, another name is testicular feminization syndrome, is the third most common cause. So, एक MCQ पे, my dear students, see the benefit which you are getting. एक MCQ पे, three MCQs more you are getting. Okay, third most common cause of primary amenorrhea. Now, can we proceed? Before we proceed, okay, so this is on. Now, can you tell me the answer to this? Very important. Again, a short. ये आने वाला है. You will remember me on the day of the exam. Okay, this is again surely going to come. 5-star MCQ. Yes. चलो, now tell me the answer. Okay, so when longest question comes, student का फट जाता है. Okay, patient come to primary amenorrhea, ध्यान से देखेंगे. Now I am going to give all of you a super mantra before we proceed further. Can you tell me ये जो Turner syndrome आपने लिखा, Turner syndrome, okay, can you tell me Turner syndrome में what about the uterus? Uterus is present or absent? Turner syndrome में क्या होता है? Yes, sir. Please understand this, that Turner's syndrome, it is not absent uterus. It is not. Uterus is present. Uterus is present. But it is ovarian dysgenesis. Okay. So ovary is replaced by fibrous bands. Okay. So ovarian dysgenesis होता है, so ovary is not functioning properly and therefore uterus is छोटू, चिंटू, क्या है, rudimentary. Yes, छोटू uterus, चिंटू uterus, because uterus requires estrogen for the growth. and estrogen कहाँ से आता है, ovary में. ovary तो काम नहीं कर रहा है, ovary is not working and therefore uterus is चिंटू. कैसे याद रखते हैं मेरे स्टूडेंट, ओके, hypoplastic, but uterus is present. Remember, it is not absent uterus. Yes, all of you know 45XO. Okay, now RMKH, exactly opposite. Clap if you feel happy. Exactly opposite. Remember this. What is RMKH? Sir, uterus is absent. Uterus is absent. Uterus, fallopian tube, upper part of the vagina absent, but ovary is perfectly normal. Is this understood? So appreciate that both of them are completely opposite. Is it clear to all of you? Now please pay attention when you get this. Yes, short stature, web neck, all that correct. Okay, now whenever you get a combo offer which you get every year आपको आएगा एग्जाम में, what is that combo offer? Okay, sir, there is primary amenorrhea also, and along with it there is absent uterus. ये combo. Okay, what is this combo package? Okay, sir, there is primary amenorrhea along with absent uterus. In the whole of gynac, only two options are possible. Sir, either it is RMKH syndrome or it is androgen insensitivity syndrome. बात समझ में आ गया? Clap. So please don't even look at option 3, option 4. तो यहाँ पे भी sir, I have got primary amenorrhea, absent uterus. That's it. So sir, Turner's syndrome, uterus is present. Kalman syndrome also, uterus is present. दो option out. Clap. ठोको ताली. Is it clear? So I have to choose only between these two. Is it clear? Whenever you get this combo, primary amenorrhea, absent uterus, think of only these two. Is it clear? Both these are out, because in both this the uterus is present. यहाँ पे भी uterus है, भले चिंटू है, छोटू है, but uterus is present. Here also uterus is present. Is this clear to all of you? Yes. So now how will I differentiate further? Yes, of course sir, this is 46XX and this is 46XY. Okay, ये तो लड़की नहीं, ये तो लड़का है. बाद में रास खुलता है when all of you do the कैरियोटाइपिंग, तो रास खुलेगा, मिस्ट्री खुलेगी. करे ये तो बहुत बड़ा गलती हो गया, गलती से मिस्टेक, ये तो लड़के ने, ये तो लड़का है. ओके, एंड गोनाड प्रेजेंट हियर इज ओवरी, gonad present here is testes, but what are we supposed to look at? Breast. Yes, don't look at the breast, because breast will be well developed in both of them. Breast here also plus plus, here also plus plus, so breast is not a difference. Yes sir, we will look at axillary and pubic hair, because sir, column number 1 is a female. Here sir, axillary and pubic hair is very well developed, and here sir, because it is axillary pubic hair is androgen dependent. Remember this, even in females. Okay, even in females, axillary pubic hair is androgen dependent, and therefore here axillary pubic hair will be absent देंगे. To make the paper tough, they may even say sparse or scanty, but mainly it will be axillary pubic hair will be absent. Is it clear? And testes will be in the inguinal. Now can you tell me this? So what is the answer over here? Yes sir, breast is well developed. Okay, absence of axillary pubic hair. ठोको ताली. You remember me on the day of the exam. Androgen insensitivity. MCQ आने वाला है, लिख के ले लो. Is it clear to all of you? And can you tell me this? What is this lump in the inguinal region? Lump felt in the inguinal region. ये क्या है? Yes, the lump felt in the inguinal region is the undescended testes. Testes will not descend down. Undescended testes. Is this understood to all of you? So if they just change one MCQ, if they remove this line, if they remove the variation in the question, if you remove one line, कि sir absence of ये line हटा दिया, lump in inguinal region हटा दिया, and this absence, if this lump in the inguinal region line I remove, okay, all of you look at the variation in the question. ये lump in the inguinal region हटा दिया line, and now if I write axillary and pubic hair present. Now what is the answer? Yes, sir. Now the answer will become RMKH. Thoko tali. Thoko. Is this clear? So how one word they are going to twist you in the exam. पूरा concept का खेल है. One liners are gone hardly. All clinical cases, IBQs and concept based questions are going to come. Yes. So we make it the original question. Absence of axillary pubic hair. Answer is androgen insensitivity. Lump in the inguinal region is the undescended testes. Testes. Is it clear? And Turner's and this is not possible. Only two things. Okay. So please say but Kalman syndrome. Then what is Kalman syndrome? Medicine. Kalman syndrome is GN, gonadotropin, GnRH, gonadotropin releasing hormone deficiency. Along with क्या होता है? Sense of smell is gone. Anosmia. So it's a hypothalamus problem. Master ही काम नहीं करे. Master level problem. Hypothalamus is not working. Got it? Got it, Mishra ji and got it, Ditankar. Okay, Kalman explain कर दिया. What is GnRH? Kalman syndrome क्या है? सर गोनाडोट्रोपिन रिलीजिंग हार्मोन कहाँ से आता है वो? एनीबडी? गोनाडोट्रोपिन रिलीजिंग हार्मोन कहाँ से आता है? यस सर, इट कम्स फ्रॉम द हाइपोथैलामस. फ्रॉम द हाइपोथैलामस it is coming. So there is deficiency. So obviously gonadotropin releasing hormone will not be there. So FSH-LH will not be there. So ovary will not function. Along with it, the sense of smell is gone. That is Kalman syndrome. But the uterus is present. Uterus will be present. Okay. Is it clear to all of you? So primary amenorrhea, absent uterus, ये दो चीज ही याद रखना है. And now the new style question. When this question comes, student panic. Match the column. यहाँ पे syndrome, यहाँ पे karyotype. चलो, all of you know Turner syndrome 45. तो कैसे ये ना कैसे सॉल्व करने का? एक चीज पहले पकड़ लो. 1A. सो ये दो ऑप्शन आउट. क्लियर? देखो देखो ऐसा सॉल्व करने का कि सर टर्नर सिंड्रोम पता है 45 एक्सो, तो 1A है. इज इट क्लियर? RMKH आई जस्ट नाउ टोल्ड यू 2C. 2C एंड वी हैव द आंसर. एंड्रोजिन इनसेंसिटिव तो लड़का है. 3B एंड 4D क्लैनफेंटर सिंड्रोम आपको योर पीडियाट्रिशियन विल टीच यू. क्लैनफेंटर इज व्हाट? 47XX. तो क्या है आंसर? Yes, sir. The answer is one. अपना ये ऑप्शन बी 1A. 1A है but 2 is not B. 2 is not B. 3 is not C. ठीक है? Is it clear? So this is the answer. Yes or no? Is it clear to all of you? So match the column is a new style of asking question. They are also going to discuss new pattern. Go एक मेरा YouTube चैनल पे जाके एक न्यू पैटर्न का भी वीडियो है, वो भी क्विकली देख लेना, बहुत बेनिफिट होगा. Is understood to all of you? Yes. चलो now very important IBQ. What is this? This procedure. First identify the procedure. Zoom करके आपको बता देते हैं कि ये बेबी है. Ultrasound guided some procedure is happening. You can see a needle which is getting poked inside, and it is not, it is in the Liker pocket. Okay, this needle is in the Liker pocket. Okay, it is not touching the baby. Clear? So can anybody tell me what is this procedure? पहले identify the procedure. Very good, Nawaz Mola. Very good. No, this is not chorionic villi sampling. Wrong. In chorionic villi sampling, you are touching the placenta. You take a piece of the chorionic villi. Yes. So this procedure is amniocentesis. Okay, amniocentesis. Is this clear to all of you? Because we are in the light. It's a confirmatory test. Now, please understand this. In the whole world, what is the question? For purpose of trisomy 21, मतलब हमको Down syndrome detect करना है. So for the purpose of Down syndrome, what is the confirmatory test? Sir, in the whole world, the confirmatory test is karyotyping. दो तरीके से. Can you tell me how can I get the karyotyping? So karyotyping can be done with chorionic villus sampling or amniocentesis. चलो, when to do which? So sir, chorionic villus sampling is always done in the first trimester, 11 to 13 weeks, and sir, amniocentesis is always done in the second trimester, generally 16 to 18 weeks. Is this understood? So this procedure, what is the name of this procedure? Amniocentesis. Now please understand, the question is that at what weeks I will perform. Yes sir, generally we perform between 16 to 18 weeks. So यहाँ पे देखें, it's a range. So 16 to 18, 16 to 19, 16 to 20, जो भी है वो. Yes, it's a confirmatory test, and amnio is done after 14-15 weeks. So 16 to 18 weeks पे generally ये perform करते हैं. Now can anybody tell me, yeah Luffy, 10 to 13 से भी better 11 to 13. Okay beta Luffy, because 10 completed weeks. Okay, so 11 to 13 is the best. 11 to 13 weeks. Okay, is it clear? Is it clear? 11 to 13 weeks is the best. Clap if you have learned something new. Now can you tell me, suppose the same picture can come, and if they tell you here it is for Down syndrome, because Down syndrome we want to detect it so that we can do MTP. MTP is now allowed till 24 weeks. So we would want to do it till 20 weeks. Okay. So amnio can be done up to 20 weeks. Can you tell me one more indication for amniocentesis in the third trimester? Suppose question आ गया कि which condition. So एक है कि आपका amniocentesis sir is done for the purpose of karyotyping. One more indication of amniocentesis which I would want to do in the second and third trimester. हाँ, correct. Anybody? चलो, one more MCQ. Tough. Which one more indication? Which one more indication where I do amniocentesis in the third trimester? Yes, very good. Nawaz Mola, Prince Thakur, Devesh Singh, the severe poly. So for the purpose of karyotyping, okay, by the way extra MCQ है, don't worry अगर ये नहीं पता है तो, okay, ये extra information है कि sir for karyotyping purpose we are doing it at 16 to 18 weeks. But sir, suppose there is severe poly and mother is having breathing problem, then when it is severe polyhydramnios, okay, severe polyhydramnios अगर है and mother, it is maternal distress, mother is having breathing difficulty, then even at 20 30 32 weeks also we can do. ये by the way है. Okay, ये कोई पूछेगा नहीं आपको, don't worry, but we should know this extra information. चलो, now again very important MCQ. When this question came, many students mark it wrong. It's an important PYQ. Again short repeat होगा. All these are extremely important MCQ. Pregnant lady comes for MTP now at 22 weeks according to the latest. तो सारे students क्या है? Yes sir, all of you know कि sir MTP was allowed till 20 weeks. Now it is allowed till 24 weeks. So all the students, when this question came कि sir according to the latest, yes sir, can be done with two doctors' opinion. Wrong. Clean bold. Clean bold. Why clean bold? Clean bold. Yes, why clean bold? Because please understand the indication. Here the patient has come. Here the patient has come with occipit failure. Occipit failure. So please understand this, that the yes, with occipit failure matlab failure of contraception. And can you tell me this 20 weeks to 24 weeks the limit has been raised is for which conditions? So 20 to 24 weeks is if there is any chromosomal or genetic problem in the baby. If there's any chromosomal or genetic problem in the baby. Is it clear to all of you? Okay, is it clear to all of you? If there's any chromosomal or genetic problem in the baby, तो ये हो सकता है. Is it clear to all of you? And if there is any Structural anomaly in the baby. Yes, congenital anomaly in the baby. Congenital chromosomal anomaly in the baby. Is it clear to all of you? And third thing is, of course, if it is rape or sexual assault victim, to save the life of the mother, it is any time. Is it clear to all of you? Is it clear to all of you? Yes. But remember, there's a last is a special circumstances, like there's a change of marital status, divorce, all that. Husband, they a couple undergoes divorce during pregnancy. But remember this, sir, failure of contraception is still only up to 20 weeks. Is it clear to all of you? Failure of contraception is still, so please write down, still up to 20 weeks only. Very important. Why? अगर आपका condom फट चुका है, OCPL failure है, you can't be sitting at home till 24 weeks. So here we are 22 weeks pregnant, and therefore can be done is wrong. Okay, after permission of hospital superintendent भी नहीं है. Medical board is afterwards. Medical board is beyond. But by chance, yes, answer is option B. Very good, all of you. Answer is option B. Okay, if by chance we can come to know that if there is a congenital anomaly in the baby, then I can do it, because then the indication will change. Okay. No, beta. These are the thing. Other reasons, yes. To 20 rape victim, separate by a chromosomal problem, any chromosome. Okay? Chromosomal problem, not compatible, or structural anomaly. Okay, structural anomaly. But please understand this again. The structural anomaly should be serious. Okay, structural anomaly should be a dangerous anomaly. Dangerous anomaly मतलब क्या है? Not compatible with life. Anencephaly, spina bifida, complex heart disease, all that. Okay, छोटा क्लेफ, एक्स्ट्रा फिंगर, एक्स्ट्रा थंब, ऋतिक रोशन एमटीबी मत करना, अदर्स ऋतिक रोशन वुड हैव बीन अपॉर्डेड. ओके, बात समझ में आ रहा है? तो छोटा सा एनोमली के लिए डोंट डू. ओके, इफ इट्स अ डेंजरस वन, then we should go and then we can do up to 24 weeks. Is it clear to all of you? Yes. Okay. Yes, moving on. All are very important, beta. Yes, yes, beta. It is now, this is a 2 hour session we're going to have, so we'll try to cover the majority portion, beta, and then you can also enroll in the OG Guru, where we're having 3 more sessions like this. Okay, is it clear to all of you? I'll tell you about this, but I'll try to cover majority of the portions. We are trying to cover majority of the portion in this PYQs, and all the images I will be showing you. Also, already one image has been shown. Okay, so stay right till then. Yes. Now tell me the answer. Screening test in the second trimester manipulability except. Now what, ये कौन सा बात हो रहा है? किसका बात हो रहा है? What can anybody tell me? Yes, screening test in the second trimester. So yes, so screening test in the second trimester is either triple marker test or quadruple marker test. Is this understood to all of you? So before we proceed, very quickly, can anybody tell me triple marker test हम कब करते हैं and quadruple marker test भी कब करते हैं? So tests are done between generally 16 to 18 weeks of gestation. 16 to 18 में. Okay, now what are the 3 markers जब भी ट्रिपल मार्कर बोलते हैं? So sir, HCG, alpha fetoprotein, unconjugated estriol. Okay, keep this in mind also, and it is E3. Don't make a mistake. E3, many students write estradiol. It is estriol. Okay, it is estriol. Okay, HCG, alpha fetoprotein, and unconjugated estriol. Okay, okay, unconjugated estriol. Okay, so is it clear to all of you? So HCG, alpha fetoprotein, unconjugated estriol, ये हो गया ट्रिपल मार्कर. And in this, if I add the fourth marker, inhibin, if I add the fourth marker, inhibin A, which is the answer, inhibin A, then it is the fourth marker. Okay, is it clear? So 1, 2, 3, and ये fourth marker add कर दिया, तो ये quadruple marker test. Okay, now also we should know the interpretation. कि किसमें क्या है. So HCG is higher than normal. Okay, and other 2 are lower than normal. This also keep in mind. And inhibin A is also higher than normal. Okay, if the baby is having trisomy 21, this also could be asked to you. In a patient of trisomy 21, दो high होगा, दो down होगा. But, can you tell me? The answer is yes, because sir, HCG is done in the second trimester. It's also done in the first. Okay, HCG is also done in the first. Okay, alpha fetoprotein inhibin. Okay, PAP-A is a part of, sir, PAP-A is a part of dual marker test. Dual marker test. Dual marker test is done when? So dual marker test is done in the first trimester. First trimester. Is it clear to all of you? So question क्या है? Second. And dual marker में क्या होता है? Sir, HCG and PAP-A. PAPPA. Okay, HCG and PAP-A. HCG is again higher than normal, but PAP-A is lesser than normal. PAP-A is lesser than normal. Is this clear to all of you? PAP-A is lower than normal. Okay, so keep this in mind. So ये आपका पूरा बहुत important है. Next, okay, consider the following statements regarding is also PYQ. Okay, now again when this question comes, there is a student's panic. Okay, yes. So what's the answer? What's the answer for this? The answer is that the what's the answer over here? PAP-A. PAP-A is PAP-A is PAP-A is lesser than normal. Okay, is it clear to all of you? Yes. Now, can you tell me this? Can you tell me this? So PAP-A is the answer because PAP-A is done in the first trimester. Clear to all of you? PAP-A is the answer because PAP-A we do in the first trimester. Yes. Okay. Now, when this kind of question comes, again directly students start marking from here. Okay. 1, 2, 3, 4. No, your option starts from question starts from here. Question starts from here. Is it clear to all of you? Consider the statements. And now the question is, which of the following given above are correct? So again, this is a new pattern. It's a new pattern where we are having multiple correct options. We're having multiple correct options. Okay. Anybody? Yes. So क्या है? So sir, prevalence regarding uterine leiomyoma. Leiomyoma मतलब fibroid. Leiomyoma मतलब fibroid. Is it clear to all of you? Now, please pay attention. फाइब्रॉइड के बारे में यस सर प्रिवेलेंस इज हाईएस्ट बिटवीन फाइब्रॉइड हमेशा 30 प्लस 45 प्लस 30 टू 45 सो फर्स्ट स्टेटमेंट इज करेक्ट मोर कॉमन इन नल्ली पैरस यस बिकॉज मल्टी पैरिटी इज प्रोटेक्ट सो दे हैव नेवर मैरिड लेट मैरिज डिलेड मैरिज आजकल क्या नया फैशन है जिंदगी ना मिलेगी दोबारा बच्चे देखेंगे अगले जन्म में सो childless with choice. Doctor, we don't want babies. So all those who don't want babies or they are never pregnant are also more chance of fibroid. Okay, of course when I give GnRH analogs, the fibroid can shrink in size after the treatment, and all fibroids do not require treatment. Absolutely correct. अगर आपके पास फाइब्रॉइड है, अगर आपको पेशेंट को फाइब्रॉइड है एंड देयर इज अ चिन टू 2-3 सेंटीमीटर फाइब्रॉइड नॉट कॉजिंग एनी सिम्टम, डोंट डू एनीथिंग, कुछ भी नहीं करना है. एंड देयरफॉर ऑल 1, 2, 3 and 4 all are correct. Okay, all correct. Is it clear to all of you? हाईएस्ट प्रिवेलेंस अराउंड 35-40 प्लस, नली पैरस में ज्यादा होता है, रिवर्सेबल श्रिंकेज होता है. Reversible matlab when the drug is over, when you give general analogs. Okay, and all fibroids do not require treatment. Is it clear to all of you? So that is your answer. 1, 2, 3, 4 all are correct. Okay, so when you get this kind of questions, don't panic. We are going to discuss like this more time also. Chalo, one more MCQ like this type. Now tell me, all are indications of ventus. Ventus matlab vacuum. So you can see, my dear students, all the important topics को हम टच करने की कोशिश कर रहे हैं. आई एम ट्राइंग टू गिव यू द मैक्सिमम पॉसिबल इंफॉर्मेशन इन द शॉर्ट पीरियड ऑफ टाइम. सो वी आर डिस्कसिंग वी डिस्कस एमसीक्यू ऑफ पीसीओएस, देन योर व्हाट यू कॉल्ड double marker, triple marker, amnio, all these are important. Now instrumental delivery. Okay, can you please explain the fourth statement, AJ pulse? Fourth statement क्या था बेटा? Yes, all fibroids do not require treatment. Very correct. Is it true? All consider the following statements which are correct, which are true. Yes, all fibroids don't require treatment. AJ pulse उसमें क्या है? So many times हर fibroid को थोड़ी treatment करते हैं. Yes, if the fibroid is there and there is only no symptoms, you don't treat it. Yes, can you tell me this? indications and prerequisite for venous liver include all of the following except. Yes. So now please understand this. Whenever there is a vacuum instrumental delivery, please understand this. Whenever we are applying instrumental delivery, two things we have to keep in mind. What are the two things we have to keep in mind? ये common है for forceps as well as vacuum. Okay, when it is forceps or vacuum. Point number one, when do you apply? The indications जब हम पूछते हैं indications, when can we apply? Yes sir, if it is prolonged second stage, mother is pushing and mother prolonged second stage, or in conditions like heart disease, I want to cut short second stage. Cut short second stage matlab I don't want the patient to bear down. Second is there is maternal exhaustion, mother is exhausted, mother says doctor OHS is नहीं बेटा OHS क्या होगा हाँ okay and third is fetal distress, fetal distress. But all of you have to keep this in mind. Okay, when I apply a forceps or vacuum, can you tell me what about the pelvis? What about the pelvis? If it is CPD, what is CPD? What is CPD? Cephalopelvic disproportion. Cephalopelvic disproportion. Okay. Cephalopelvic disproportion. What is cephalopelvic disproportion? Can I apply this in this? Cephalopelvic disproportion मतलब sir baby head is very big. छोटा हाथी 4 किलो 5 किलो. Okay, and or the pelvis is narrow. Pelvis is narrow. There's no space only for the baby to come out. Yes. So please understand this. If it is CPD, forceps vacuum cannot be applied because sir the pelvis has to be adequate. All of you look on the board. I should know that there is adequate space for the baby to come out. Then only I will pull the baby with forceps or vacuum. So please keep this in mind. That pelvis should be adequate. Pelvis should be adequate for both forceps as well as vacuum. Pelvis should be adequate. There should be no CPD. OG in the chat box. Is it clear to all of you? But one more important point. Can you tell me vacuum? What will happen if I apply vacuum on the baby's face? अगर बेबी का फेस है, अगर बेबी का फेस है, ओके अगर बेबी का फेस है और हमने वैक्यूम लगा दिया तो क्या होगा? आई बॉल्स विल पॉप आउट, आंख बाहर आ जाएगा. क्लियर? सो रिमेंबर दिस माय डियर स्टूडेंट के वैक्यूम इज ओनली फॉर वैक्यूम इज ओनली फॉर vacuum is only for vertex presentation. Clap. V for vacuum, V for vertex. So vacuum can only be applied in vertex presentation. Vertex पे लगा सकते हैं. And very important क्या है कि sir if it is a prematurity में, that means if the baby is 31, 32, 33 weeks, then what will happen? So when I apply vacuum, preterm babies are anyway more prone to intraventricular hemorrhage, and when I apply vacuum again there will be more chance of intraventricular hemorrhage. Is this understood? And therefore if it's a prematurity, then vacuum becomes a absolute contraindication. vacuum नहीं लगाएंगे. Cross. Is it clear to all of you? तो यहाँ पे the question is indications as well as prerequisite. So vertex presentation, yes. Non-reassuring fetal heart rate मतलब fetal distress at full dilatation and delay in the second stage, yes. Basically ये third नहीं, gestational age less than 34 weeks is a absolute कॉन्ट्रा इंडिकेशन. जेस्टेशनल तो 3 नहीं आना चाहिए. तो जहां पे भी 3 है उसको कट कर दो, 3 को उड़ा दो, 3 को उड़ा दो. 1 2 4 clap. Is it clear? This is surely coming in the exam. Very important. So whenever it is a what do you call, whenever it is a prematurity, if they tell you 30, 32, 33 weeks, 34 weeks, 34 weeks is a prematurity. Why is it absolutely contraindicated? So it will lead to increased risk of intraventricular ventricular hemorrhage with vacuum. Is it clear? Forceps is okay. Forceps can be applied. So 1, 2, 4 is fine. Forceps, yes. Perfectly correct. Yes. Now chalo, one more MCQ. Revision. आज ही बताया. Okay. Which of the following is not true in trisomy 21? Yes, perfectly correct, sir. Look at the graph which I already shown to you, which we have already shown to you. यहाँ पे देख लो sir, क्या है alpha fetoprotein down, estriol down, but HCG is higher than normal, inhibin is higher than normal. Is this understood to all of you? So PAP-A is decreased. Yes, PAP-A decrease होता है. NT, what is NT? Anybody? And tell me the value of NT. चलो NT scan कब करते हैं? And tell me at what weeks? And alpha fetoprotein also becomes less. Is it clear to all of you? Answer is this, sir. HCG is not lesser than normal. It is higher than normal. Is it clear to all of you? Please tell me about this also. Please tell me about NT. What is NT and when is the NT scan done? Yes. What is this value? Chalo. Again, a very important MCQ. Okay, so ideal time to perform NT scan is at what weeks of gestation? Okay, so yes, NT is nuchal translucency. क्या होता है? Every baby. Okay, so this is the baby, suppose. Okay, the picture also is very important. I'll show you in radiology also. And ऐसा baby होता है. Okay, is a baby. So to zoom this part, we to zoom this part. Okay, okay, suppose ऐसा baby है, तो we zoom this much part, and yes, every baby at the nape of the neck, at the nape of the neck there is this translucent space. So we put a caliper here, we put a caliper here, and we measure this space. And anybody, कितना होना चाहिए, कितना होना चाहिए? Yes sir, this NT should be like 1 millimeter, 2 millimeter, 1.5 millimeter, all that is okay. Yes, up to 3 millimeter or up to 3.5 millimeter is okay, but in Down syndrome the NT is more, and if the NT is more than 3.5, that is bad. It is suggestive of, it's not confirmatory, okay, it's suggestive of Down syndrome. And this scan is done between 11 to 13 weeks of gestation. Very important. Yeah, 1 to 2 millimeter is correct. Perfectly correct. Okay, 18 to 20 weeks pe, can you tell me which sonography is done? 18 to 20 weeks pe which sonography is done? 18 to 20 weeks pe the biggest sonography, biggest matlab the most important sonography. Anybody? Most important scan of whole pregnancy. Yes, we call it as anomaly scan, or malformation scan. Anomaly scan or malformation scan. Is this understood to all of you? Yes, in NT is only a screening test. Very good, Pratyusha. And tabs that, what is tabs that? Okay. TIFA, very good. TIFA scan. It is also called as TIFA scan. Targeted imaging for fetal anomaly. Yes, anomaly scan or malformation scan, that is done around 18 to 20 weeks. Is it clear to all of you? Yes, NT more than 3.5 is suggested. Perfectly correct. All of you super. OG in the yes. Now again very important. Now two variations in the question. If I remove the word live, earliest diagnosis of pregnancy is by, आंसर सेम होगा या डिफरेंट होगा? एंड इफ आई ऐड दिस वर्ड लाइव, नाउ विल द आंसर बी डिफरेंट और द आंसर बी चेंजिंग? Yes, so please understand this, that when it is about pregnancy, the UPT, the UPT becomes positive. UPT क्या होता है? हम वो किट करते हैं, आपने देखा होगा प्रेगा श्योर, प्रेगा न्यूज। जो भी हीरोइन प्रेग्नेंट होती है एंड डिलीवर होता है, उसके बाद उसको मॉडल लेते हैं। तो बहुत साल पहले प्रेगा न्यूज, ओके, बहुत साल पहले शिल्पा शेट्टी had just delivered, so she was the model. And I predicted that Katrina Kaif will be there. So Katrina Kaif became pregnant, married, and now she was the model. Okay. Then there was Anushka Sharma. Okay. अभी next किसका नंबर आ जाएगा? अभी next कौन आएगा पता नहीं. Next who will come? I don't know. कृति सेनन या कौन, we don't know. Okay. So प्रेगा श्योर प्रेगा न्यूज जो होता है, where you put these two drops, दो बूंद खुशी के, दो बूंद जवानी के आप डालते हो, and then you get one line, two line, कभी खुशी कभी गम. Why कभी खुशी कभी गम? Because the pregnancy is planned, khushi. If it's unplanned, tension. So this is UPT. Now please understand this, the UPT is detecting urinary HCG, and it is always positive only after missed periods. After the lady misses the periods, after missed periods, okay. हाँ, कियारा अभी आ जाएगी, वेरी गुड, कियारा अडवाणी नेक्स्ट मॉडल, परफेक्टली करेक्ट, बिकॉज जस्ट डिलीवरी हुआ है। कियारा के बाद अभी पता नहीं कौन आएगा, नेक्स्ट किसका नंबर होगा बताओ। ओके, ओनली आफ्टर मिस्ड पीरियड्स इज द यूपीटी पॉजिटिव, बट यूरिनरी एचसीजी के अलावा सीरम, यस सर, serum beta hcg is positive even before the lady misses the period. Okay, serum beta hcg positive before missed periods. बात समझ में आ रहा है? Before missed periods, so that is the earliest. Okay, yes, so please understand this, that if the question, first I am teaching you the variation, if the question is कि सर earliest diagnosis of pregnancy कैसे करते हैं, आंसर is serum beta hcg. समझ में आ गया? Okay. Okay, is it clear to all of you? So serum beta hcg is positive before missed periods. Clear to all of you? But that is not the answer over here, my dear student, because the question is about live pregnancy. Now please understand this, serum beta hcg का report होगा 2000, 3000, 5000. How can you tell whether the baby is live or not? Never. So whether the pregnancy, ध्यान से सुनना कि सर pregnancy is inside the uterus, outside the uterus, ectopic, live baby, dead baby, वो सब हमको जब पता चलेगा when we do ultrasonography. And in ultrasonography, transvaginal sonography is positive, because for live pregnancy हमको क्या देखना है? बेबी का हार्ट बीट, ठक 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 ठक, बेबी बोलता है जिंदा हूं मैं, टाइगर, पठान, पठान का था ना, जिंदा है, टाइगर जिंदा है, पठान जिंदा है। तो लाइव प्रेगनेंसी वी कैन कम टू नो ओनली बाय fetal cardiac activity, and that is possible only by doing a transvaginal sonography. Is this understood to all of you? Transabdominal will pick up live pregnancy after 1 week. Okay, is it clear to all of you? After 1 week. Okay, so transvaginal sonography roughly by 5 weeks 5 days, or roughly 6 weeks. Remember that, before 6 weeks, 6 weeks याद रखो, या 5 weeks 5 days. At 6 weeks or 5 weeks 5 days, when I do the transvaginal sonography, we can pick up the baby heartbeat, thak 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 thak, which will tell you it is a live pregnancy. Serum beta hcg is only going to telling you about pregnancy. It tells you about pregnancy, but not live और नहीं. Okay, live है या dead है या intrauterine extrauterine, वो नहीं पता चलता. Clear to all of you? चलो, one more important IBQ surely आने वाला है. ये क्या है? Anybody? Yes. So, sir, this is very good. Completely fine. Is it copper T? No, there's no copper wire. There's no copper wire. ठीक है, कोई भी कॉपर वायर नहीं है, सो इट इज नॉट अ कॉपर टी. What is it? Yes, sir. The brand name is Myrina, and basically it is LNG, intrauterine device, and also called as LNG. And can you, chalo, tell me in the chat box two other benefits. What are the uses? Yes, the question is what is the content and the total quantity. Please understand this. 20 microgram per day is released. ये भी याद रखना है. Okay, how much is released per day? 20 microgram, but that's not the question. Yes, sir. LN, it is not having estradiol progesterone. It is LNG, 52 milligram total. Total is 52 milligram, which is the answer over here. समझ में आ गया आप लोगों को? Yes, it is Myrina, LNG, 20 microgram per day. 20 microgram per day. And what happens to the menses? Yes, sir. When we insert Myrina inside the uterus, the menses become scanty, scanty, scanty. And it, because of continuous progesterone, okay, and therefore it is used in manage, apart from contraception, it is useful in management of, yes, heavy menstrual bleeding. We can use it in heavy menstrual bleeding, menorrhagia, dysmenorrhea, adenomyosis, endometriosis. It's one of the management for heavy menstrual bleeding. Is it clear to all of you? It can be used in other than contraception. Keep that also in mind. Okay, so total LNG content is 52 milligram, and 20 microgram per day is released, is also keep in mind. This is the LNG IUD Myrina. Is this crystal clear to all of you? Chalo, very important MCQ. Again, very short. Septum, septate uterus. Patient has come to the hospital with a septum. तो कैसे करोगे? Okay. Now, again, students have total confusion. Sir, laparoscopy, hysteroscopy. Is it clear to all of you? Okay. I will make your confusion clear lifelong. What is the difference between hysteroscopy and laparoscopy? Anybody? So please understand this. If all of us are sitting inside one classroom, and I am seeing all of you, it is the inside view. So sir, hysteroscopy is a telescope which I will put through the vagina. Vaginal route say through the cervix, we enter into the uterus and we see the cavity of the uterus. Anything to do with the cavity, that is your hysteroscopy inside. So क्या क्या हो सकता है? Suppose sir there is Asherman syndrome. Again a very important MCQ. What is Asherman syndrome? Intrauterine adhesions, or sir there could be a endometrial polyp or some fibroid in the cavity, or a septum matlab parda hai parda. Okay, if it is a septum which is projecting into the cavity of the uterus, it can lead to repeated abortion, miscarriage. Is it clear to all of you? Yes. Is it clear to all of you? So we are looking at the inside, and my dear student, hysteroscopy is also for simultaneous management. I can cut the adhesion. See, I can cut the adhesion. Breaking. Hysteroscopic adhesiolysis. One more MCQ. Hysteroscopic polypectomy, myomectomy, and hysteroscopically we can go and we can cut the septum. Thoko tali. Is it clear? So, sir, for septate uterus, what we require is a hysteroscopy septoplasty. Septoplasty bolo ya septum resection bolo is the same thing. Septum resection, septum excision. Is it clear to all of you? That is the okay, septum resection or septum. This is the hysteroscopic septoplasty. Is it clear to all of you? All of you clear? So hysteroscopically, we will go and through the uterus, we will be seeing inside. Okay. So remember, hysteroscopy is the cavity view or the inside view. One more question, two, three more questions will come. You will become perfect. Now, laparoscopy is what? So, through the terrace. Yes, we go on the terrace of the building. So, from the terrace of the building, I cannot make out who is standing inside. Is it clear? Who is inside the classroom? All of you go, yes or no, go on the terrace of the building. Wherever you are. From the terrace of the building, can you see how many students are inside the classroom? 5, 10, 15, 30? Never. So, sir, when I want to see the outer view, when I see the uterus from outside, but usme extra information we get. Sir, we can see the fallopian tubes. We can do the tubal patency test. Okay, or that methylene blue, all that. We will see the ovary. We can see the uterus. All that is laparoscopy. Is it clear? So laparoscopy is the outer view where we see the pelvis. So here we can see, all of you look on the board. So suppose there are adhesions between the tube and the ovary. If there are adhesions between the tube and the ovary, pelvic adhesions, then I require laparoscopy. Is it clear to all of you? Suppose there is endometriosis, there's some chocolate cyst in the ovary. All that I can see through the laparoscopy. So now all of you, so the answer over here is hysteroscopic septoplasty, hysteroscopic septal resection. We don't do laparotomy, नहीं करते हैं, and we can't do laparoscopic resection, and we don't do laparoscopically. Is it clear to all of you? So now if I tell you yes, chalo, tell me the answer to this very important MCQ. Again, short. Hysteroscopy in all the following except yes, ovary दिखेगा. Ovary किस में दिखेगा? Laparoscopy में दिखेगा. Clap. Nobody will teach you like my guarantee. Yes, sir. Abhi bata diya. Sir, hysteroscopy is to see the cavity of the uterus. So, sir, Asherman's syndrome में करेंगे, endometrial polyp में करेंगे, and of course for infertility patient, all this will cause infertility, isn't it? This adhesion septum can cause infertility, and infertility के लिए it is cavity is important because cavity में तो implantation होने वाला है. So any patient who is infertile, we do this. Endometriosis requires laparoscopy. Endometriosis के लिए laparoscopy is the investigation of choice. Isn't it clear to all of you? Asherman syndrome, fibroid polyp, I told you. All this. Adhesions अगर है, and all this can also cause infertility, isn't it? ये सब infertility भी करेगा. So of course for infertility patient you require to do this. Okay, so this. So now can you tell me, all of you, if I tell you two MCQs, chalo, tell me the answer. You will tell me H in the chat box and L if it is laparoscopy, hysteroscopy. HL game. Now tell me this, all of you. If they tell you, see students क्या है, adhesions पढ़ा, mark कर दिया. No. If they tell you it is intrauterine adhesions, chalo bolo HKL, another name is Asherman's syndrome. क्या करेंगे? Hysteroscopy, laparoscopy? Yes, the answer is capital H, hysteroscopy. But suppose if they tell you adhesions are present between the tube and the ovary, I would want to see if between the tube and the ovary there are adhesions, or in the pouch of Douglas and there are pelvic adhesions, तो हम क्या मार्क करेंगे? ठोको ताली, clap all of you, ठोको ताली, clap. Nobody will teach you like my guarantee. OG in the chat box. Okay. And this, my dear student, is just a trailer. As I told you, I'm trying to cover maximum. We are going to have 3 more sessions, 11th, 12th, and 13th of this month. Exactly after 2 days, we are going to have 3 more sessions, where in one session I'm going to discuss entire IBQs. Then we are going to discuss also about the images and also this. So that it's just 290 rupees. All of you download Doji Guru app and you will see the difference in your performance. Tremendously our score boost up hone wala hai. So for pelvic adhesions or tubo-ovarian adhesions, we require a laparoscopy. Is this crystal clear to all of you? So exam में please याद रखना है. Yes, again very important MCQ. MTP. Patient wants MTP at 45 days. क्या करना है? Okay, so sir, this medical method of MIFI-MESO can be done up to 63 days. Okay, 63 days में आप कर सकते हो. Till 63 days you can do it. Okay. Okay, yes. Now what is it? Please pay attention. This is a combi kit. This is a combi kit where we have one single tablet and another four long tablets. Is it clear to all of you? Yes. What is the drug first? Total confusion among the student. तो मीफी, MIFE, मीफी में आता है F, and therefore मीफी clap, मीफी is given first. Is it clear to all of you? So this single tablet is mifepristone and it is 200 milligram. Do not confuse. Single tablet oral. कैसे देंगे मिफिप्रिस्टोन? ओरल देते हैं, ये भी पूछेगा आपको. एंड कैन यू सी द फोर अदर टैबलेट्स? ये किसका है? Four other tablets are what? Sir, four other tablets are misoprostol, PGE1. After 48 hours, we have to wait for 48 hours, then the action becomes better. And meso is the second. कैसे again याद रखना है? जब मैं हूं ना उजी गुरु, तो S में है मीजो में है S, and second में भी है S. So meso is given second, and you can see each tablet is 200 microgram और into 4 है, तो 800 microgram. We can give it vaginally or sublingual or even oral. That is okay. Clear to all of you? So कैसा है ये? आउट, बिकॉज इसमें मीजो फर्स्ट दिया है. आउट, ये भी आउट, मीजो फर्स्ट दिया है. नाउ बिटवीन A and C, कैन यू टेल मी द आंसर? Yes. What is the answer? Can you tell me why A is not the answer? Sir, A is not the answer because units बदल दिया है. Is not 200 microgram, 800 milligram. Answer change. Okay, unit change. Mifepristone 200 milligram followed by 800 mcg मतलब microgram after 48. Absolutely correct. C is the answer. Okay, so please don't make a mistake in the exam. Exam में majority लोग आप पढ़ो. Don't panic. My advice to the student, that's why please go and see my YouTube video जो भी मैंने just recently post किया है. I have posted a video recently on the YouTube where I have said about the last 20 days strategy. Please go and see it. Okay, last 3 week strategy. Last 3 week strategy का एक वीडियो हमने डाला है. I want all of you. It's on my YouTube channel where I have told you where I have told you exactly कि कैसे panic नहीं करना है, how many days to study, what subjects to study, what to do. So all of you please go and see that last 3 week strategy का video on my YouTube channel. It's of course free for everybody. And वहाँ पे मैंने बताया है कि mistakes what students are making is they are not reading the questions correctly. Obstetrics में reading the questions very very important. Is it clear to all of you? So please understand this. Yes. So यहाँ पे sir this is not 200 microgram, mifepristone 200 milligram and 800 microgram. Okay, 48 hours के बाद, and therefore we call it like day one and day 3. Is it clear to all of you? And this is what I'm talking to you all of you about. Just 299. I've kept it at the very slow. Only the platform fee. Only the platform fee. Already so many students have already enrolled, and many of you I'm going to see you on 11th. 11th से start करने वाला. 11th of June से 3 live sessions are there. One पूरा images दिखा देंगे, clinical MCQs, and this and only in 299. Just download the OG Guru app, and 3 sessions, totally 6 hours more. So if this 2 hour session is going to help you, see how much more 6 hours will also give you. Okay. Now again a IBQ. Again a IBQ. What is identify the instrument? Again a PYQ. And this device we don't know the name of the device. This device least likely to be used for. Least likely among 4 options दिया है, which will be the least likely? Anybody? Okay, least likely to be used for. So what is this? So this is a uterine sound. This is a uterine sound Very good. What is the purpose, sir? To measure the uterocervical length. Uterocervical length. No, all of you ध्यान से पढ़ो, clean bold. Okay, wrong नहीं बेटा, B नहीं है. Least likely to be used for which? So please understand this. Wherever I have to do any intrauterine procedure, sound से क्या measure होता है? Sound also acts like the first dilator. We first put the sound से हमको क्या पता चलेगा? Why do I put a uterine sound first? I put a uterine sound first. We put a uterine sound first so that that acts like a first dilator. We also come to know uterine sound, say whether the uterus is anteverted or retroverted, also we come to know. And very good, Pratyusha, we can, because if this is the sound, if this is the sound, then it goes inside like this, so you can measure the uterocervical length. Clear to all of you? So why? Because sir, then you will not go beyond it. So suppose I know that this much is the UCL. My next instruments, if I put more, UCL has suppose 4-5 centimeter. If I put, इसे अगर हम बड़ा सा अंदर घुसेड़ देंगे, perforation. So of course sir, DNC के पहले I require sounding. IUCD evacuation के पहले also suction evacuation के पहले also I require sounding, and IUCD insertion के पहले also. Yes, very good. IUCD removal, IUCD insertion very important. Of course you have to measure the UCL before IUCD insertion, because so you know कि you can place the IUCD inside up or down, because अगर आपने बहुत नीचे place कर दिया, expulsion. Removal of IUCD में there is no role, नो रोल ऑफ साउंड. रिमूव कैसे करते हैं? यस सर, रिमूव कैसे करते हैं? डायरेक्टली विथ अ आर्टरी. फॉर दिस इज द कॉपर टी, दिस इज द थ्रेड्स. रिमूव कैसे करना है? जस्ट होल्ड द थ्रेड्स विथ अ आर्टरी फोर्सेप्स एंड पुल इट आउट. यस और नो? यस और नो? सो सर, फॉर आईयूसीडी रिमूवल के लिए देर इज नो नीड ऑफ साउंड, नो need of uterine sound for removal of IUCD. Clap if you have learned something new. Thoko tali on a Monday morning. So the answer is least likely or not at all used in ABC में करेंगे. So all suction evacuation में sound करते हैं, IUCD insertion में definitely sound करते हैं पहले. Okay, no role in removing the IUCD. Clap. Yes, somebody said this कि सर ये भी हमको बताओ. आपने बोला, मैंने दिखा दिया. What is this and how does it differ from? Yes. So remember this, कि whenever there is history of ovulation induction agents, specifically which ones, sir? If when we go for IVF, if recombinant FSH or HMG, human menopausal gonadotropin is used. Okay, yes, and specifically what is the main culprit? HCG. Remember, when for final trigger, when this is followed by the HCG injection, there is a risk of OHSS. इसमें क्या होगा कि all the follicles are, yes, see, this whole ovary has only become very big, and they are big follicles. Yes, they are all big follicles, and they are also coming in the center. Is this understood to all of you? So do not make a confusion. PCOS, I have already told to you, follicles, this is a necklace pattern. Follicles are small. Okay, follicles will be small. And very good, all of you told me they are in the periphery. They are in the periphery. Is this understood? But sir, OHSS, and of course remember साथ में actually this they don't give in the exam, but they should give. There will also be presence of ascites. Free fluid होता है, ascites भी होता है. ओके, असाइटिस भी होता है पेशेंट को. ओके, एंड OHSS, big follicles. Okay, they are big follicles, plus also they will also come in the center also. Whole ovary will be bulky, and plus they will also be actually presence of ascites, and there will be history. This history of ovulation induction is there, so it is OHSS. Clap. Is it clear to all of you? Yes. चलो, ग्रेट वाइट, द सिंपलेस्ट MCQ. अगर ये नहीं पता है, मुश्किल, डोंट गो फॉर द एग्जाम. ओके, ग्रेस वाइट डिस्चार्ज, पॉजिटिव विफ टेस्ट, ये किसमें आता है? Yes, and what is the treatment? So it's a grayish white discharge is a positive whiff test. Or there's one more, we'll discuss Amsel's criteria, that is for bacterial, yes, bacterial vaginosis, and the treatment is metronidazole. Metronidazole. Okay, what is it? You get a fishy odor. Okay, what is this test? Yes, bacterial, BV. Okay, bacterial vaginosis or Gardnerella. Okay, when you take the secretions and we add 10% KOH, there is a fishy odor. That is metronidazole is the answer. Is this clear to all of you? Yes, very simple MCQ. It has come many times. Positive if test. Don't make a mistake in this MCQ. Yes. Now again, a very important clinical case. Very important. Now, isme the whole game. She had an abortion. That is fine. She underwent a curettage. That is a clue. That is a clue. Curettage. And can you tell me what can happen? This excessive curettage or overzealous curettage. After that, she has not got her periods. But the most important part is FSH is 5. Now, please tell me this FSH given to you 5. Is it less, normal, more? ये important है. Yes. So please understand this. This FSH5 is normal. FSH5 is normal. Okay. Now, please understand this. Can you tell me if it is ovarian failure, what will be the FSH? So please remember this very important OG Guru mantra. Okay. Master servant relationship. Sir, pituitary is the master. जहां से आता है FSH, and ovary is the servant. Okay, pituitary is the master and ovary is the servant. अभी आपके घर पे also, at your home also, if your servant is not working properly, if the servant is not working properly, what will your parents, or what will you to shout at, what will you do at the servant? You will shout कि baba work work work. Same thing, isn't it? If you are not studying, your teachers will tell you baba study study study. Same thing. So your ovarian function, when it is going down, the master will secrete more FSH. So FSH will be more when the ovarian function is going down. Is it clear to all of you? So sir, when it's a ovarian failure, this FSH would be 20, 30, 40 ऐसा दिया होगा. After 40 तो it is menopause. Is it clear? एंड व्हेन पिट्यूटरी फेलियर, मास्टर ही जब सोया है, ओके, व्हेन द मास्टर का ही प्रॉब्लम है, इट्स अ मास्टर ओनली प्रॉब्लम. इफ इट्स अ मास्टर प्रॉब्लम, देन द FSH विल बी वेरी very low, isn't it? So pituitary failure, sir, the FSH will be very low. Low matlab kitna low? 0.53. Levels will be very low. This 5 is normal. 3 MCQs I will tell you. So the answer is, because it is a intrauterine adhesion. Sir, in adhesion both master servant both are normal. Yes or no? Sir, if it's a intrauterine adhesions which we just now showed you, sir, pituitary is normal. Pituitary normal. Ovary also normal, isn't it? OV also normal. Pituitary normal. And therefore FSH will also be normal. Thoko tali. Thoko tali. Is it clear to all of you? So now just remember this. Just remember, if I give you same MCQ, एक MCQ तीन variation, OG Guru Kamal. If I make this 5, if I make this 5 into 50, what is the answer? If I say FSH is 50, what's the answer? Nobody will teach you like this, my guarantee. OG in the chat box. Yes, so if the FSH is 50, then it is ovarian failure. FSH 50 suggests that lady has already reached menopause. Menopause, ovarian fail ho gaya hai. Ovary has failed for FSH very, very high. And if I make this phi, if I make this phi into zero point 0.5, FSH 0.5, तो क्या आंसर होगा? यस सर, FSH वेरी वेरी लो, then it is pituitary failure. ठोको ताली. Is it clear? OG in the chat box. Clap, clap, clap. Okay. So no. So here FSH 5 is normal, and sir, intrauterine adhesions. I repeat, ovarian failure will be very very high. So they'll give you a range. Okay, and pituitary failure will be very very low. Pituitary failure, remember like this. They'll give you 0.5. Basically, less than 1. Less than 1. Less than 1 is very low. Okay, यहाँ पे FSH will be normal and ovarian failure में FSH will be high like 20, 30, 40. Okay, 5 to 10 you consider normal. Is it clear to all of you? Yes, super. Okay, now what is it? Young patient, nulliparous patient है, 24 years old and prolapse. How many of you want to do hysterectomy? हिस्टेरेक्टमी किसको करना है? हिस्टेरेक्टमी जिसको करना है उसको डालेंगे जेल में. जेल. Why? Because if a 24-year-old nulliparous patient I do hysterectomy, you will have to go to jail. Is it clear to all of you? Yes. And remember, my dear student, Fothergill surgery का क्या problem है? Fothergill surgery is to be avoided. Because can anybody tell me what I do in Fothergill surgery? Sir, Fothergill surgery, we are doing cervical amputation. Cervical amputation. 8 is also normal, beta. Dipendra, 8 is normal. 5 to 10 you consider normal. 7, 8 is also okay. When they want to give you high, na, they will tell FSH like 20, 30, 40. So 5 to 10 is normal. 5, 10, 5, 7, 8, 9, 10 is all okay. If they give you in this range, okay? 5 to 10. 5 to 10 you consider it as normal only. Okay? 5 to 10 you consider normal. Okay? Ovarian failure, they will give you like 20, 30, 40. Yes. So sir, in Fothergill operation we do cervical amputation. तो उससे क्या होगा? Anybody, what will happen with this Fothergill operation? All of you look on the board. चलो, that's again MCQ. Fothergill repair all of the following except. तो sir, in Fothergill operation what was done was, okay sir, uterus, cervix, and we chop off the cervix. Fothergill में हम cervix को काट, we used to do cervical amputation and create a new cervix. So when I do this cervical amputation, either the cervix becomes too tight and patient develops cervical stenosis and infertility. Patient develops cervical stenosis, infertility. During labor, cervix may not dilate, cervical dystocia. But more dangerous, it can lead to cervical incompetence. And if it is cervical incompetence, yes, repeated abortion, but when? So cervical incompetence will always cause repeated painless, word is clue, painless abortion in the second trimester. Thoko tali. Is it clear to all of you? Always repeated second trimester abortion. The specialty is painless. So sir, Fothergill repair, can it cause cervical dystocia? Can it cause preterm labor also? Yes, keep in mind that also. Okay, cervical incompetence and also preterm labor also can happen. Preterm, all that can happen with the Fothergill. And not the first trimester. First trimester abortions, the causes are all chromosomal and genetic. Okay, Fothergill will always cause second trimester because of cervical incompetence. And therefore Fothergill operation is to be avoided in a nulliparous patient if it's a never Fothergill. Clear to all of you? तो कैसे याद रखना है, कैसे याद रखना है? 15 साल पहले अक्षय कुमार मूवी सिंग इज किंग, सिंग इज किंग, यस सिंग इज किंग, यस और नो? अक्षय कुमार मूवी सिंग इज किंग, and yes sing is king and sling is king. Sling surgery lifelong you will not forget. Sling is king का मतलब है sling surgery. Sling is king matlab sling is the best operation, and that is the answer over here. Sling surgery. Another name for sling surgery is cervicopexy. Okay, don't make a mistake. Cervicopexy option में दिया है, same है. Okay, Lefort is only in postmenopausal lady only. Yes, postmenopausal lady and not fit and multiple other conditions. Correct. Okay, is it clear to all of you? So sling is king and sling surgery, but cervicopexy is another name. Thank you, Deve. Okay, yes, cervicopexy अगर दिया है और abdominal sling surgery mean the same thing. Crystal clear to all of you. So please don't do Fothergill in a young patient because it can cause second trimester, not first trimester. Okay, first trimester abortions are chromosomal genetic. Is it clear to all of you? Yes. Is it clear? So आपको either cervix can become too tight, stenosis, infertility, or cervical incompetence, second trimester abortion, painless abortion. Keep that in mind. Yes. Again, a sure shot, very important MCQ. क्या है? I only want the diagnosis. I don't want the answer. Primary gravida, 31 weeks, BP 180, 110, albumin +4, no convulsions at present. How many of you are saying this MCQ as eclampsia? How many are saying as eclampsia? Wrong. It is not eclampsia because it is written no convulsions. तो ये eclampsia तो नहीं है. बट पता चलेगा नहीं बेटा. सी जो भी सी बोल रहा है रॉन्ग. क्लीन बोल्ड. वी आर 31 वीक्स एंड यहाँ पे द पेशेंट, ऑल ऑफ यू क्लीन बोल्ड, पेशेंट इज सडनली कंप्लेनिंग ऑफ हेडेक, blurring of vision, oliguria. So what are these? These are very, very dangerous. Yes, only preeclampsia wrong. Very good, dazzling. So this, my dear student, is not only preeclampsia because BP is high, albumin +4. This is impending eclampsia. इम्पेंडिंग एक्लाम्शिया का मतलब क्या है? इम्पेंडिंग एक्लाम्शिया का मतलब है कि सर अभी राइट नाउ देर इज नो कन्वर्जन बट नाउ एनी टाइम कन्वर्जन कैन हैपन. Okay, anytime convulsion can happen. It is impending eclampsia. Yes, dangerous signs and symptoms are present. And what are those dangerous signs and symptoms? Anybody? પાંચ. They are called as five dangerous signs and symptoms. क्या बोलते हैं? जब ओजी गुरु है, जब मैं हूं ना तो ओ भी इजी है ना. क्या याद रखना है? ओ बी इजी है ना. ओ से हो गया ओलिग्यूरिया, बी से हो गया ब्लरिंग ऑफ विजन, ई से हो गया एपिगैस्ट्रिक पेन, एच से हो गया हेडेक एंड एन से हो गया नॉसिया एंड वॉमिटिंग. ठोको तालियां बजती रहनी चाहिए. So when this symptoms cluster is present, I repeat, oliguria, blurring of vision, epigastric pain, headache, nausea, vomiting, patient will develop 2-3 out of it. This is very, very dangerous. These are called as premonitory symptoms. Premonitory symptom, very dangerous because now the patient becomes impending eclampsia. Convulsion can come anytime. Okay, and look at our question. Yes sir, we have got this cluster. All fine need not be present. Sir, here we have got oliguria, we have got headache, we have got blurring of vision. When this is present, my dear student, please understand this, that is the last day of the pregnancy. Pregnancy cannot continue further. आपने वो हिंदी पिक्चर में देखा होगा डायलॉग, डॉक्टर लेबर वार्ड के बाहर आता है, हम माँ और बच्चे में से किसी एक को बचा सकते हैं। वो गया जमाना, फालतू पिक्चर। ओके, इन ऑब्स्टेटिक्स तो ऐसा होता ही नहीं है। फिर कोई बोलेगा, खड़ूस सास बोलेगी डॉक्टर बहू को मरने दो, बच्चे को बचा लो। लविंग हस्बैंड बोलेगा नहीं नहीं सर, वाइफ को बचा लो। डॉक्टर बोलेगा, डॉक्टर को हुम टू सेव, एनीबडी, किसको बचाना है? हुम टू सेव द मदर, सेव द गवर्नमेंट बोल रहे सेव द टाइगर, डॉक्टर बोल रहे सेव द डॉक्टर, इंटर्न बोले सर सेव द इंटर्न, कॉर्नर में एक डॉक्टर को बोला सेव द डॉक्टर। ओके, सो यस, इन ऑब्स्टेटिक्स इट इज ऑलवेज मदर फर्स्ट, एंड देयरफॉर रिमेंबर माय डियर स्टूडेंट, ये 7 स्टार स्लाइड है। When we have a patient of impending eclampsia, let the patient be 24 weeks, 26 weeks, 28 weeks, 30 weeks, 34 weeks, 36 weeks, जो भी weeks दिया है, जो भी weeks दिया है, impending eclampsia, you can never wait and watch. If you wait and watch, we will have to put you to jail. जेल में डालेंगे। Why jail? Because mother will get convulsion, mother dead, baby dead. So whenever it is impending eclampsia, remember, I have to go and do the delivery of the patient. Okay, I have to go and do the delivery of the patient. And why delivery? All of you write down, because delivery is the definitive treatment. Delivery is the definitive treatment. Of course, I will give something before, and the delivery has to be done irrespective. Most important words coming in the bracket. Okay, irrespective of weeks of gestation. समझ में आ गया? Please draw 5 stars around this. Irrespective of weeks of gestation मतलब के let the patient be 24, 26, 28, answer will not change. But before, because it is impending eclampsia, we will also give magnesium sulfate. Why? To prevent convulsion. Magnesium sulfate will be given, of course BP medicine will be given, and again remember, and this is magnesium sulfate prophylactically. Again remember, when we give magnesium sulfate, we never, after magnesium sulfate, you cannot say, chalo now let me wait. No, after magnesium sulfate, delivery has to be done. We prefer to do induction of labor, never directly go for cesarean section. Okay, so now labetalol and wait and watch, jail. If you wait and watch, jail. Labetalol, very good. But delivery at 34 weeks, no, because we are 31 weeks. Can I wait for 4 weeks? No. And those who said C, wrong, because यहाँ पे क्या था? Delivery at 37 weeks, wrong, wrong, wrong. What about the lung management? नहीं होगा, lung तो भूल जाओ. So of course I will give magnesium sulfate. Why? To prevent convulsion. Labetalol to control the blood pressure will be given, and immediately induction of labor. D is the answer. Is it clear to all of you? Very good, Pratyush. The answer will not change. यहाँ पे 31 weeks होने दो. Let it be 24 weeks, 28 weeks, 36 weeks. Yes. What about the lung maturity? Sorry. Yes, you can give steroids, but there is no time. You can give steroids for lung maturity, but the delivery process has to be started. If steroids are helpful, very good. Okay. Why? Because when it is impending eclampsia, we cannot wait. Is this crystal clear to all of you? Can I get 10 thumbs up? I want 100 thumbs up, then only I'll proceed further. So when it's impending eclampsia, you never wait and watch. Magnesium sulfate is given prophylactically, and then delivery has to be done. Delivery is the definitive treatment. Crystal clear to all of you? So immediately, because we are 31 weeks, I can't wait till 34, 37. All that is wrong. If you wait till 37, mother will die. So magnesium sulfate given to prevent. Here why we are giving? Sir, to prevent convulsion. Prophylactically. Prevent convulsion. Of course, labetalol is given to control the blood pressure. Control the blood pressure. But induction of labor is the definitive treatment, because the condition will only improve. Mother's condition will only improve once I induce the labor and once I do the delivery. Is this understood to all of you? Yes. So, and again, अगर MCQ आता है eclampsia, same thing. If you get eclamptic convulsion also, max self and deliver. माँ और बच्चे में से माँ को बचाना है. मदर इज मोर इम्पोर्टेंट. बेबी यस सर, इफ माई NICU इज गुड, 31 वीक्स बेबी बच जाएगा, वेरी गुड. बेबी कैन नॉट बी सेव्ड, सॉरी, क्योंकि अगर मदर है पीछे पूरा क्रिकेट टीम आ सकता है. ओके, मदर बच गया, माँ बच गया, तो सेकेंड टाइम, थर्ड टाइम, 3 4 babies, as much as we can, they want to have babies, they can do so irrespective of weeks or days. Crystal clear? Yes. What is the Pritchard level पे? Again, three things. What all we do? 4 to 7, 4 to 7 milli equivalents per liter is the therapeutic range of magnesium sulfate. What are the three things what we monitor when the patient? Sir, we have to monitor the knee jerks, respiratory rate, and urine output. Knee jerks, respiratory rate. Okay, okay. Knee jerks, respiratory rate, and urine output are the three things what we monitor, and 4 to 7. Okay, 4 to 7. Okay, and before we proceed further, please take 10 seconds time, all of you. I have put so much important videos on YouTube. Please go and subscribe to the YouTube channel right away. Follow on Telegram, the PDF will also be uploaded on the Telegram. And please follow on Insta, every day super information, MCQs we are putting, important reels we are putting, and all exam oriented, no time pass. So quickly follow on Insta also, OG Guru, and get in touch with me on phone and WhatsApp on this number. I'm personally guiding all the students how to study. Okay, yeah, PDF will email to this people, and they will also do it, and I will also put it on the Telegram of this also. Is it clear to all of you? Yes. Okay, moving on to the next. बहुत simple. क्या है ये? बहुत simple. क्या है? Yes, when this is a primary amenorrhea, primary amenorrhea, cyclical abdominal pain, every month डॉक्टर पेशेंट बोल रहा है सर, पेन पेन पेन. Okay, so this is your cryptomenorrhea, and this is nothing much, tense bulging hymen, yes, imperforate hymen. Okay, so it's, remember this, when you get a combination of cyclical abdominal pain and your primary amenorrhea. Okay sir, periods are not coming, and we know we take a cruciate incision, tense bulging hymen. Okay, bulging hymen. Okay, bluish tense bulging hymen, cruciate incision, imperforate hymen. The blood gets collected inside the vagina, which is called as hematocolpos, that presses the bladder, and therefore there can also be urinary retention episodes. Is this understood to all of you? So please keep this in mind. Moving on, again, very very important, whenever the patient comes to the OPD with bleeding at 36 weeks, that is antepartum hemorrhage. What are the two things we have to keep in mind when the patient has bleeding in the third trimester? When the patient has bleeding in the third trimester, yes, यहाँ पे the important word is painless bleeding. BP normal. That is also a clue. Uterus relaxed, very important clue. And baby head floating. All these are the clues given to you. Yes. And this is placenta previa. Eclampsia में तो convulsion होगा. And abruption में क्या होगा? Sir, abruption is always painful. And abruption, one more thing is what happens to the uterine tone. Yes, uterine will be tonically contracted. Uterine tone is increased because of all the blood inside the uterus. Uterine tone will be increased, or uterus will be tonically contracted. Okay, these are the clues for abruption. This is all the clues, placenta previa. Yes, so keep this in mind. KPP, placenta previa, and abruption में the main thing, this is painless bleeding, not associated preeclampsia, and here it is painful condition. Okay, ये भी याद रखें. And preeclampsia can lead to abruption, so the BP is on the higher side. Okay, is it clear to all of you now? Very very important. So first the diagnosis, then the answer. So all clinical types questions we are discussing. Okay, yes. Yes, anybody? Is it clear to all of you? Yes. Now again we have got a patient who has painless bleeding. Okay, BP normal, uterus relaxed, head floating. So what is the diagnosis? So diagnosis is placenta previa, and directly what mistake everybody? Placenta previa, cesarean section. Wrong. Clean bold. Placenta previa में yes, cesarean section करना है. Placenta previa में cesarean section करना है. But my dear student, look at the first thing. 33 weeks. Can I wait and watch? Remember this, okay, sir, placenta previa, we can wait and watch. How, when, why? Abruption, we never. Abruption may never wait and watch. Okay, because abruption keeps on increasing. Mother dead, baby dead. So placenta previa mein I can wait and watch. Abruption never wait and watch. Now here, what is this called as? Yes, sir. Michael Jackson, McAfee, and MJ. यहाँ पे क्या है? Yes, three conditions. If three conditions are satisfied, what you do, sir? We admit the patient, give her bed rest, give her steroids, give her tocolysis. Okay, and yes, look at the thing. Mother should be stable, isn't it? If the mother is not stable, wait and watch for what? For the mother to die. Then don't wait. So mother should be stable. There should be no fetal distress. Obviously, है कि नहीं? If there's fetal distress, then also you can't wait. Is it clear? If it's fetal distress, directly go for LSA. Then don't wait. And pregnancy should be less than 37 weeks. If all these three conditions are satisfied, we are getting 3 out of 3, then only wait. Okay, yes. So we can see on the question paper BP 120/70, hemoglobin 11, mother stable, fetal heart rate 140, normal. There is no fetal distress. And can you tell me यहाँ पे है 33 weeks? So wait and watch. Is it clear? I would like to wait till 37 weeks bus, and once you reach 37 weeks, then I would wait till 37 weeks. Don't wait further. We can like to wait till 37 weeks, and at 37 weeks we will do a cesarean section. Okay, जो भी करेगा induction of labor, क्या होगा उसका? What will happen if you induce labor? अगर पेशेंट को है प्लासेंटा प्रीविया, अगर पेशेंट को है प्लासेंटा प्रीविया, and if you induce labor, if you induce labor, what will happen? More bleeding. So never induce labor. You will have to go to jail. समझ में आ गया? समझ में आ गया? Okay, so if you induce labor, you have to go to jail. Similarly, forceps delivery also next. So delivery is always by LS. Yes. And now see one more variation. If this MCQ, let it be 33 weeks. If I make this fetal heart rate, if I make this fetal heart rate 90 per minute, what is your answer? Not rupture. Rupture nahi hoga beta. If I make this fetal heart rate 90 per minute, answer emergency cesarean section. Thoko tali, clap. Is it clear? Because sir, it is indicating fetal distress. If I wait, baby will die. Is it clear? All of you clear? Similarly, if I make this 33 weeks into 37 weeks, then again the answer will be cesarean. Because sir, now what is the point to it? Clear? So एक variation आप सोचो. If this 2 hour session, my dear student, if this 2 hour session has given you so much benefit, and I'm sure yes, please all of you, I want you to see on 11th also, and come, and we're going to have 6 hours totally. 2 hours, 2 hours, 2 hours, 6 more hours, 6 more hour sessions. You will get the maximum marks in OBGY is my guarantee. Yes, if it is 37 weeks also, sir, now there is no point waiting. Now there is no point waiting further, because sir, after 37 weeks to anyway delivery kar dena hai, because sir, labor can start anytime. So why wait? Is it clear? So sir, I repeat, sir, here we are 33 weeks and mother is stable and baby is stable, and therefore wait and watch is the answer. Induction of labor will have to go to jail. Forceps is not possible. So sir, 33 weeks hai and mother stable, baby stable, we can do. This is called as McAfee and Johnson regimen. All the three condition, we admit the patient and we give bed rest and steroid. Is it clear to all of you? Second few, okay. Now what is this? Whenever there is a delivery, the patient starts to bleed heavily, uterus is flabby. Uterus is flabby, so it is atonic pph. Atonic pph में we try all the medical management first. If the medical management fails, what do we do? So sir, misoprostol of course can be given. Oxytocin is the first drug of choice, and carboprost is PGF2 alpha is also given. Mifepristone, mifepristone I told you is for MTP. Mifepristone is for MTP in the first time. Mifepristone has no role in atonic PPA. Okay, PGE1, PGF2 alpha, methergine, prostaglandin are the four drugs available. Atonic PPH is your diagnosis because uterus is flabby. All are in the management except. And the last point, can you tell me this also, sir? If you first do the massage and all that, and if the medical management we give first, and if the medical management fails, again a PYQ, and then I have to proceed for the surgical management. Anybody बीच में क्या कर सकते हैं? Anybody fill in the box. बीच में क्या कर सकते हैं? Again a PYQ. Okay, sir, when the medical management fails and final option is surgical management, we have to try the balloon tamponade, the Bakri balloon, your tranexamic acid will be given, yes, agreed. Bakri balloon tamponade or your condom tamponade, okay. Okay, Bakri, okay, Bakri balloon, yeah, condom tamponade packing will be done. Again, a very important MCQ, and if that also fails, then we go for surgical management. Chalo, I want the diagnosis first. Okay, I want the diagnosis first. So here, sir, we have a patient who is having 2 months amenorrhea. Pulse very good, BP very good, HCG level only 1500, very good, and uterus is empty. So uterus is empty, and what do we see outside the uterus? Uterus में कुछ नहीं दिख रहा है. On the right side, मतलब right side of the mother, we are seeing a 2.5 by 3 centimeter mass. So this is a unruptured ectopic pregnancy. Unruptured. Why? Because patient is stable, and therefore, my dear student, very good, we don't need a surgery, we don't wait. Answer is methotrexate. And after giving methotrexate, why repeat it? Beta A nahi, beta Kshitij are wrong. If you repeat USG after 2 weeks, ectopic will rupture, bomb blast. Again, if you repeat USG after 2 weeks, you have to go to jail, because on ectopic here the diagnosis is done. Right sided mass, what is that mass? Ectopic pregnancy. Okay, unruptured, very good. And after giving methotrexate, what do we have to monitor? HCG level should keep on going down, 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 down. Okay, methotrexate can be given when, sir? Methotrexate can be given if the HCG levels are less than 5000. Okay, HCG levels initially are less than 5000, and the gestational sac should be less than 4 centimeter. जो यहाँ पे है, यहाँ पे the sac is only 2.5 into 3, and preferably the fetal cardiac activity should also be absent of the baby. But the most important, yes sir, it has to be a unruptured ectopic, मतलब patient should be stable. Okay, so patient stable, and if the HCG levels are less than 5000, gestational sac is less than 4, answer is methotrexate. Yes, and monitor. Is this understood to all of you? The most common anomaly in the baby of the diabetic mother is VSD. VSD is the most common. Anencephaly or the neural tube defect is the second most common. And do not get confused, all of you. The caudal regression syndrome is not the most common. Caudal regression syndrome is the most specific. most specific anomaly, most specific anomaly in the baby of the diabetic mother. Don't make a mistake. Is this clear to all of you? Yes. Now this MCQ I have just taken to show you the importance of one drug. All are tocolytics. Tocolytics matlab uterine relaxants. So ritodrin is a tocolytic agent. Nifedipine calcium channel blocker is also a tocolytic. What is atosiban? Sir, atosiban is a oxytocin antagonist. And magnesium sulfate also has a tocolytic property. What is the answer over here? Carbetocin. ये क्या है बे? What is this carbetocin? Anybody? Sir, carbetocin, sure shot. New drug. Sir, carbetocin is for prevention. It is a drug which we give prophylactically for prevention of PPH. Prevention of PPH. It is a oxytocin derivative. But what is the speciality? Sir, it is stable at room temperature. That is a most, yes, it is not a, it's a uterine contraction. It or contraction karega. Carbetocin will make the uterus contract. So it is not a tocolytic except pucha hai. So oxytocin, yes, it's a oxytocin derivative. It is a oxytocin derivative which is stable at room temperature, heat stable. Very important drug going to come for sure in this exam. It's for prevention of PPH. We can give it. This is clear to all of you. All are part of AMCEL's criteria except, yes, sir, AMCEL criteria is again for diagnosis of bacterial vaginosis or Gardnerella, grayish white discharge, positive whiff test when you add 10% KOH, and presence of clue cell. एक sign. Can you see the difference? Only this one sign. Yes, this sign. pH is not less than 4.7. pH has to be more than 4.7. Crystal clear to all of you. So see how one sign also can change the diagnosis, change the answer. Keep these points, all these points in mind. Crystal clear to all of you. Yes, so even one sign can change the answer. Now what is the diagnosis over here? What is the diagnosis over here? Sir, patient has come to you with shock. Patient has come to you with shock. Why am I saying shock? BP 90 by 60, hemoglobin 7, and she is how many months? 2 months. So what do you think first? Shock in, and the urine test is positive. So what is the diagnosis? क्या rule याद रखना है? Sir, shock in early pregnancy. Sir, shock in early pregnancy is because of ruptured ectopic pregnancy. अनलेस बेटा इन्वर्जन रॉन्ग, कचरा डस्टबिन, बेटा इन्वर्जन होता है आफ्टर डिलीवरी. इन्वर्जन होता है आफ्टर फुल टर्म डिलीवरी. पवन ओके, याद रखो. यहाँ पे पेशेंट क्या है? फर्स्ट ट्राइमेस्टर. आप क्वेश्चन नहीं पढ़ रहे हो. 2 मंथ्स. 2 मंथ्स पे यूट्रस इन्वर्ट होगा? नहीं होगा, कभी तक नहीं होगा. ओके, ये फर्स्ट टाइम है. यस, वेरी गुड. इट इज योर ruptured ectopic pregnancy. And what is the डेफिनेटिव ट्रीटमेंट? तो रप्चर्ड एक्टोपिक में जिसने भी मीथोट्रेक्सेट मार्क किया, जेल. मीथोट्रेक्सेट नहीं डाल सकते. मीथोट्रेक्सेट इज ओनली फॉर स्टेबल पेशेंट. स्टेबल अनरप्चर्ड एक्टोपिक. इज इट क्लियर टू ऑल ऑफ यू? तो shock in early pregnancy is ruptured ectopic unless proven otherwise. Okay, keep this rule in mind. And whenever it is a ruptured ectopic pregnancy, what do we do in ruptured ectopic? In ruptured ectopic pregnancy, of course, first is understood. Okay, sir, immediately we will go for that airway, breathing, circulation. We will put two wide bore IV line. Two wide bore IV lines. Collect blood for cross match. Okay, cross match. Start, arrange for blood. IV fluids. ये सब जनरल मैनेजमेंट है, जनरल मैनेजमेंट. यस. एंड देन इमीडिएटली शिफ्ट टू ओटी, shift to operation theater, and remember, cut the tube. Don't feel sad. Quick in, quick out. Salpingectomy is the gold standard surgery. Don't feel sad. Oh, we are cutting. One tube is enough for population explosion. Salpingectomy is the gold standard surgery. Is this understood? Because till the time the tube is torn, yes, and in shock we prefer laparotomy. So we don't do laparoscopy and salpingotomy. Kachra, salpingotomy, kachra, salpingotomy, kachra. Yes, salpingectomy is the gold standard surgery. A is the answer. And when the patient is in shock, laparotomy is preferred first. Is it clear to all of you? Laparotomy is preferred in shock. Is it clear to all of you? Why? Because please understand this, कि sir the tube is stone. समझ लेंगे कि sir the tube is stone. This whole tube is stone. It is tethered. It is bleeding. तो ये पूरा bleed हो रहा है. So till all this tube is bleeding, 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 bleeding. So till the time you clamp the tube and get it out, the bleeding does not stop. Okay. So salpingectomy has to be done. Okay, salpingectomy has to be done. Is it crystal clear to all of you? And this is again a very important. Now I'm sure all of you will get it correct. Okay, these are the conditions, these are the investigation. Match the column. I told you Asherman syndrome is what? Sir, intrauterine adhesions के लिए हम करते हैं hysteroscopy. 2A, 2A, 2A. दो ऑप्शन आउट, दो ऑप्शन आउट. चलो, एंडोमेट्रियोसिस, आई जस्ट नाउ टोल्ड यू. एंडोमेट्रियोसिस में क्या दिखता है हमको? सर एंडोमेट्रियोसिस में व्हेन आई पुट इन द टेलीस्कोप फ्रॉम अबव वी गेट व्हाट? सर वी विल सी द चॉकलेट सिस्ट. एंडोमेट्रियोसिस में और क्या दिखेगा? चलो टेल मी स्टूडेंट, what all we see in endometriosis? Sir, in endometriosis we get fruit salad, blue lesions. We can get blueberry lesion, blue. What else? Matchstick burn spots, black color, gunshot, black spots. Blueberry, red raspberry, isn't it? Red color, purple. So all this is fruit salad. Very good. We also get a chocolate cyst. We get a chocolate. Assume ये brown color है, chocolate cyst. So all this you will see only, and we see the adhesions. Pelvic. So for endometriosis, I have to do laparoscopy 1B. 1B यहाँ पे भी है. Yes, and sir, whenever there powder burn spot is the black color spots, beta. Okay, medicine. Okay, black color spots. And torsion के लिए there is a twist in the pedicle. Color Doppler is the investigation of choice, because whenever there is a torsion, the pedicle of the ovary will get twisted, the blood supply gets occluded, and 3C, and that is the answer. And normal fibroids के लिए ultrasonography 4D is okay. Is it crystal clear to all of you? We don't do fibroids के लिए color. Okay, so this is the answer. This is the answer. Is it clear to all of you? Yes, Asherman syndrome के साथ histro yes, 2A, 2A, Asherman syndrome, hysteroscopy 2A, endometriosis, laparoscopy 1B, ovarian torsion, color Doppler, sure, color Doppler is investigation for 3C and 4D. Is it clear? Yes, C is the answer. C is the answer. 4D. Fibroid के लिए normal ultrasonography is enough. Ovarian torsion के लिए we have to see color Doppler. Because, and what will we see? Anybody? If it's a torsion, what will we see? Torsion में sir we will see absent flow. The blood flow will become absent. You will see absent flow on color Doppler. Because when there's a twist in the pedicle, the blood supply will get occluded. Blood supply gets occluded. Is this understood to all of you? And endometriosis के लिए I need to go and put in a laparoscopy to see all this blue lesion, black lesion, red lesion, and the chocolate cyst and the adhesions. Is this understood to all of you? And my dear student, final chance to boost up your OBGY score just in 299. Download the OG Guru app 11th of June. 2-3 दिन के बाद 3 दिन के बाद 3 sessions 11, 12, 13th, 3 sessions, 3 live sessions, 2 2 hours each. And of course, this session I've tried to cover majority things in this 2 hours time. Many more MCQs like this similar will be conducted. It's only MCQ based discussion. Whichever source you have studied from OBGYN, don't worry. And beautiful colored handwritten notes also will get. Every student has told me, so once you've seen the video, we can revise the entire note just in 2 hours time. And this is all your lovely messages which you have been getting after the exam. Same thing will happen with all of you. Sir, OG Guru, sir, thank you very much. All the questions, sir, your exam, you only truly saved me. All questions directly came from the way you taught us. Okay, thank you very much. Second half, the exams all came from your notes and lecture. So same thing will happen with all of you when you will also study. I wish, and you will surely do very well in the exam. And remember this, फिर से मेरा गोल एक, FMGE, फिर से मेरा गोल एक. I wish all of you best of luck. Don't waste time. Time is of utmost importance. मैंने एक 3 weeks का strategy video डाला है. Have lot of faith in your ability. Motivation. Do you want to pass FMG? Yes. So now you are motivated. Don't waste time in motivation, but put in lots of efforts and have strength and courage. But I will decide it, but mostly same time, 11 to 1. But and recordings will be available. Don't worry. All recordings will be available till the June exam. If you miss the live classes, don't worry. Recordings are going to be available. Okay, recordings will be available till June exam. Till June exam, the recording will be there. Okay, till June exam, the recordings will be available. So if you miss the record live class, that is not to worry about. Okay, and most important, what I want to tell all of you in obstetrics, read the question correctly. आप question नहीं पढ़ोगे. Read. They have given you clues. Read the fetal heart rate. Read the weeks of gestation. Read the mother condition, baby condition, and then decide. Okay. Okay. Yes. Okay. Yes. Very good. Thank you. Okay. So you will have to see the whole question and then decide what you want to do. Is it clear to all of you? So download the OG Guru app. If any difficulty, you can WhatsApp me on this number, and please follow on Insta. If you have already not done, subscribe to the YouTube channel, and YouTube पे जाके video देख लेना, and PDF will also be available on Telegram. Bye bye. Best of luck. Thank you very much. And here's wishing you all the best. All of you will pass the exam. I'm waiting from your results, and then you will message me. Okay. So बिल्कुल be stress free. स्ट्रेस फ्री, अच्छे से पढ़ो. एग्जाम के दिन पे क्लियर माइंड से जाना. आई ऑल्सो पुट वन मोर वीडियो हाउ टू बी फॉर द एग्जाम डे प्रिपरेशन. ओके, सो यस विशिंग यू, एंड थैंक यू एनएलसी फॉर इनवाइटिंग मी. थैंक यू आशीष सर फॉर हैविंग मी हियर, एंड बेस्ट ऑफ लक टू ऑल द स्टूडेंट्स. बाय बाय, बेस्ट ऑफ लक. थैंक यू वेरी मच.